Good evening, good afternoon, everybody, depends where everybody is. Welcome to Kigali Council on Foreign Relations. We are very much excited for the conversation today. I want to welcome all our ambassadors and the diplomats joining us, and also the private sector community joining us today, especially the members of our CEO's Council. I see a few my friends from the banks community and finance community joining us. Thank you very much for joining us today for a very interesting conversation. Just before I jump in and give the floor to moderator, I want to welcome Honorable Michel, the African Union Special Envoy for Africa Medicine Agency and the former Undersecretary for the United Nations and Executive Director for UNAIDs. Michel, the Honorable, thank you very much for giving us time, and very looking forward to for the conversation. And also I want to welcome our moderator, Dr. Sabin Nsanzimana, the Director of Rwanda Biocenter, who's his team are leading the COVID response to Rwanda. And I'm sure I'm saying this, and many people are saying this, Dr. Sabin, thank you very much on behalf of everybody for the wonderful work you and your team are doing with COVID-19, and much appreciate and from our side here, but thank you very much. Anyway, so before I give the floor to our moderator, two things I always have to remind everybody. One is Dr. Sabin will jump to the questions with our speaker for the first 20 minutes, and then the last 10 minutes will go off the record and open questions and answer. Please start sending your questions, and then we'll jump them when we can. We have almost 600 people, more than 600 people actually, I see now. So we'll try to take as questions we can in the last 10 minutes. But without taking much, thank you very much. And Dr. Sabin, the floor is yours. Thank you.
Great. Thank you, Yannick. And thank you, everybody, for joining us today. Dr. Michel, we are very pleased to have you. And
thank you.
Really having after got this invitation to be part of this conversation with you, was for me an important moment again to connect back in our past time working together in the HIV response. When I was heading HIV program in Rwanda for the last 10 years, you were heading the response to HIV globally in your previous role at the UNAIDs. And it has been a tremendous journey to see how can change disease from a death sentence to a chronic disease that people live with and actually continue to enjoy their lives, and as well improve the economies of their countries. And now having you on our continent, not only in your previous role, but also what you're doing currently to improve the lives of people, medicine, public health, and also advocacy in so many ways, the rights of people living different diseases. I remember in a previous role, you were emphasizing on the rights to health, access, equity, and many other functions. So you've been entrusted by the African Union, the countries on our continent, so that you became the special envoy for the African Medicine Agency. And for many people who are following us today, they probably don't know exactly what is this about, and also your assignment, how tough it is, and I'm sure it's not that of an impossible mission to you, because I can see always on social media there's great progress on this important task for the continent. So I would start by asking about this assignment and how you received it, and of course you will probably tell us a little bit on this urgency itself and how you see it coming in, and how to help to change the lives of Africans, knowing that most of the disease is actually on this continent. So over to you, Dr. Michel, and again, welcome to this conversation.
Thank you very much, Dr. Sabin. I am so pleased to have this interaction with you today. Particularly, I want to thank sincerely Kigali Foreign Affairs Council. I think this initiative is just great. I was so pleased when they asked me if I could really give some of my time to interact with you. And I want to start by saying that this appointment is certainly very important. But before saying that, I know that no one talked about the fact that I was a Minister of Health and Social Affairs #2 of the government of Mali, which I was proud to be. And because that prepared me also to the function I'm having today. Of course, global issues are very important, but when you're involved in your national activities, when you're starting understanding the gap from the ground, it prepares you to what I'm trying to do today. I'm just saying in very humble way, I am serving as a high-level advocate on behalf of African Union for supporting, the signing and ratification of this African Medicine Agency. It has been decided by, of course, a head of states that this treaty needs to come into force. But to make this treaty coming into force, we need 5 ratifications. And when 5 ratifications, so when they asked me, they said, ratifying a treaty is not an easy process. First, you need to really make sure that countries, they can be able to understand about this treaty. What means African Medicine Agency? What are the advantages to ratify that one for the country and for the continent, for the region, when you're talking about sub-regional groupings? But also, you need to convince a government to really have a cabinet meeting on these issues. And from there, you have to go to the parliament. If you have a Senate, you have to go to the Senate. And after, it needs to be promulgated by the president, and then the instrument or deposit in African Union. So it's a lengthy process. So what we have been able to do is to say that let us quicken the pace. Concluding in Geneva now, a tour that I started 2 months ago. And by the way, I started in Kigali. To still really quicken the pace, like I said, of the ratification of the treaty, which will help us to have at least this African Medicine Agency established. I met with some 15, I visited 18 countries in 2 months and 10 days. I met with some 15 heads of state, ministers, of course, foreign ministers and stakeholders, including regulatory authorities. And I am proud to report that as today, 15 countries have ratified the treaty. So we achieved the first goal. But amongst those 15, 6 are in the process of depositing their ratification instrument with the African Union. And for me, that is the key. Already showing that a sense of urgency is there, that the countries are really quickening the pace of their action by taking emergency procedures in many countries where I have been, so to make sure that we can have this very important agency into force.
Great, great. I think this is, as you said, an interesting and exciting task to you, given your previous role and what you're doing. Actually, I should have mentioned that you being a Minister of Health and also being given this task was like asking you to do the things you want to make happen. So it's easier. It's a kind of motivation to yourself and to the people you're serving in your own country, Mali, and also in on the continent. But many people would ask, is this task an easy one? You mentioned the long process it has to go through cabinet, through parliaments, through signatures and many other applications. But almost every week, I see that you've made a step. Do you see more steps ahead, or do you think the next chapter is the easiest?
No, Sabin, let me just, before even talking about the next step, to maybe explain a little bit why it's so important to have this African Medicine Agency. You know why it will help us to certainly strengthen our health system in Africa. You know, with almost 17% of the world's population in Africa today, you know, I can say that we have out of this 1.3 billion people, we have today the highest burden of disease. We have almost 25% of the world disease in our continent. But more than that one, we know that almost 90% of malaria infection are occurring in our continent, 60% of HIV. But we have only 6% of the whole world healthcare spending in our continent. But if you reflect seriously on the issues, a high level of disease burden, but most of critical disease are in our continent. We are seeing emerging pandemics, but more than that one, we realize that investments which are made on health globally are not happening in this continent. So we have today only 3%, I said 3% of the medicine consumed by our people who are produced in the continent. The pharmaceutical supply chains, you know that better than I do, have multiple intermediaries and contributing to the fact that the cost of the drug is almost the highest in our continent today than any other place in the world. So in addition to that one, you have the fake medicine, the counterfeit medicine, which are almost reaching 30 to 40% in some countries. So that is creating a major challenge in our system. And particularly, we realize that all of that, those challenges have been largely attributed to a fragmented system, a weak regulatory system, and unclear policies and incomplete or inconsistent legal and regulatory framework. So this AMA is critical. It will help us to certainly put in place a strong regulatory system and help us probably to reform the health ecosystem to enable us to have an opportunity, certainly first, to fight those fake medicine, produce our own vaccine or our own medicine, but also mutualizing our competency base in this continent, which is so critical, and push even for Africanizing research and development. So this ratification process was just the first step. And I want to say that your question is a very important one. After ratification process is ending, we need to, at the same time, think about how to establish this agency, what will be the content of this agency, how it will constitute a strong voice for the continent, not just a scientific and technical voice, but also a political voice.
Interesting. I'm actually thinking that the momentum we are in now with this new pandemic, the COVID-19 pandemic, is another push and point for reflection on the importance of this agency for our continent, knowing that the medicine consumption, also the research aspect is actually the lowest compared to other continents, as you rightly explained. I probably want to jump on the COVID crisis. And currently we are talking about, in many countries in Africa, the third wave. In some places, we don't even know how many waves are going to have, or how many waves we've had already. Do you see this, of course, is a challenge, but it could be kind of opportunity to push this agenda forward, having this urgency in this critical time, and helping the continent to be well prepared for the next waves or maybe future pandemics. What are your reflections on this?
No, I think it's important for us really to take seriously what is happening, because this new coronavirus is not just a public health crisis, is really, I can say, a human security crisis, because this virus has disrupted the commitment of all countries and the habits of their citizens. We are seeing even the level of investment which are being made today is showing clearly that we are facing unprecedented crisis, which is spreading, by the way, suffering and disrupting people's lives. We saw that in every different places. We saw even Paris becoming a ghost city. People are nowhere, no one. Who could have even believed 1 second that we would have seen full cities empty? But today, what is the most, I think, striking problem for me is the global deployment of COVID vaccines. This global deployment is not inclusive, is not adequately planned, and this deployment has a bias in favor of developed countries. We are seeing today, unfortunately, that after so many months, we don't even have more than 15 million people in our continent out of 1.3 billion people who had 2 doses of this vaccine. We have more than 1.2 billion people who didn't have up today 1 dose of this vaccine. So it is really showing clearly lack of equities, lack of social justice, lack of redistribution of opportunity for the poorest segment of the world society, particularly our continent. So I can even say, and I don't want to make anyone embarrassed, but we are facing a vaccine apartheid today. And you cannot have that and think that you will control a pandemic, mainly when you know that most of those virus, it is not circulating only in the place where you will have the chance to give a boost vaccine to people who have already 2 doses, but it's circulating, like you said, in our continent. And we're talking about really a disease which will not be stopping if you stop it in one place and let the virus circulating in other places. We will see a endemic situation which will create even more problem for the future. So it's very important from my point of view, the lesson you were talking about. We must not be, I think, stricken, I don't know, with what I will call myopia today. We need really urgently to work together. It is crucial to reinvent the new model of solidarity and to achieve greater equity between nations. I think that is the lesson we need to really take over with all of us, because the issues is not just the issues of Rwanda or Mali, but it is a global, truly a global issue. And if we don't have a solution globally, we'll continue to see this virus circulating. And the risk is that we will have an endemic situation which will be difficult to be controlled.
Great, great. When you mentioned the equity, I quickly thought about what has been done again on HIV and how just 20 years back, maybe or less, there was a niche of access to even diagnostics and medicine for this other pandemic that you've worked in at the top of the UNAIDs for more than a decade. And in many places, they were thinking how HIV response or lessons we've got in fighting this other pandemic can be brought in here to fight COVID-19. We want to hear from you, actually, since you know better HIV in those years, and COVID-19 response, the control on the continent. And I see what they're saying for HIV in 90s. Do we need to wait so many years to get antiretrovirals or antivirals or vaccines for COVID-19? Or what are the lessons we can pick from our past experience in HIV and apply it here in COVID-19 response and try to not wait the time waited to get antiretrovirals on our continent?
You know, I think it's a very good point, referring to my personal experience and AIDS. You know, the reality is that it was not easy at the beginning. You know, our hospital were full of people who were lying without any medication. And we have been trying to break the conspiracy of silence by making sure that we create a social movement, by having civil society and others really pushing to make sure that this become a real, true political agenda. And what happened with HIV is that we reinvent completely what I'm calling a global health diplomacy. We have been able to change completely the paradigms of working between political leaders, decision makers, civil society, community groups, and also people who are involved in innovation, producing medicine, and fighting to make sure that we could get a weather which will push to go for producing even generics. So it was a long journey. We have to be careful. That's why I said, if we don't fight with, for example, African Medicine Agency to be able to reduce our dependency. I was talking about 3% of just medicine we are producing, you know, 1% of vaccine, to improve our sovereignty vis-a-vis our health. It will not happen. With AIDS, we wait almost 7 to 8 years. You remember, before those medicine we could give to our own people. We negotiate to reduce the price. We were paying $15,000 per person per year. We reduced to $70, even less probably today. But we were giving 18 pills per day to people. And we managed with innovation because civil society movement, because the demand creation, because the pressure which has been put on politicians, we have been able with this global health diplomacy to reduce that from 18 pills to 1 pill. And certainly we are thinking about giving certainly an injection or pills every 3 months or even more. So it changed completely the paradigm. What we are seeing today, from my point of view, is that a government are slow to react with COVID. We don't have the same pressure from civil society. We don't have the same dynamic between people who produce innovation and people who are asking for making this innovation a public goods for people. So the paradigm remains completely, I think, owned by people who are producing those vaccines, people who are working on those. So it's time for us from the continent, that is my personal view, to not continue to be taken hostage in terms of research and development by the North. Unless we are capable to Africanize our research and development base, it will not be possible for us to go and have universal access for our people. Because the reality is that no one will produce things which are not related to their own priority. And it is our job to fight for making sure that what is our priority will be on the table and will be able to produce for that. Just giving you one example, you talk about AIDS, I will give you malaria. Malaria has been discovered 141 years ago. 141 years ago. And until today, we don't have vaccine. We don't have proper drugs. But COVID took 1.5 years to have how many vaccines, candidacy vaccines for. So we need to think about a true appropriation of our research base. And that's why I think that the main disconnect I am seeing today, unfortunately, in the current debate on COVID is between the reality of interdependencies and the incapacity today of the government to agree at the political level on how to address these interdependencies in terms of the one who need today this drug and the one who produce it or vaccine. So this is a huge, unfortunately, disconnect, which is striking me every day when I'm traveling. So it's important for us to really not be, African Medicine Agency can be key for that. First, to really help us to rethink completely our ecosystem by having a better regulatory system standard, by making sure that we can Africanize at least research and development, making sure that we can fight against fake medicine, producing vaccine, promoting vaccine, and certainly medicine production in the continent. I think that is very important.
Absolutely. Very important when you talk about vaccines. I was thinking about an HIV vaccine, I was thinking about malaria vaccine, hepatitis C vaccine, but this COVID vaccine is probably the most urgently needed vaccine in the world right now. And the continent is looking at having these vaccines produced locally as soon as possible. And the AMA is going to be a key step or actor in this process. So I wanted to ask you, what the states, African Union or countries need to do now so that we catch up with time on vaccine production here and availability before COVID takes more lives on our continent?
No, I think acting at this level is critically important. And I can see all the political leaders, particularly President Kagame and others, have been advocating strongly to make sure that Africa could start really producing this vaccine or even essential drugs. I think is key. It's key for different reasons. First, it will be the only way we can really catch up and save our people and go for more equity and reducing inequality and making sure that at least the segment of the population who are left behind can have access to services adequately. And I think for me, that is key. You cannot have that if you produce only 1% of the vaccine, you cannot. But it is key also because, you know, if you look at really today, the pharmaceutical sector represents, I said, $1,400 billion. Out of this $1,400 billion, Africa is representing 0.7%. So it's nothing. And it is an opportunity for us to be creating jobs, to transform our economy, to really take part of this big capacity which are out there, which could help us to transfer technology, to make sure that we train better people. So it is key for us. So AMA will enable that. But it will help us also. I saw it in Kigali, I saw it in different countries where I have been, that we are all working now to really reinforce our pharmacovigilance capacity, our bioequivalence capacity, our regulatory system. So it's not like we are starting from nowhere. So we can build on that one, which is key. But the African pharmaceutical sector is also expected to grow from 19 billion, I said, that is the market of Africa in 2012, to almost 60 billion in 2022. So soon. So I think for me, Africa market will be probably the fastest growing market in the world of pharmaceutical. So we cannot just observe that and say, okay, fine, we will not do much about that. So it is very important for us to invest in this sector for, like I said, for the health of the people, for economic reason. But to do that, we are obliged to strengthen the regulatory system, you know, for drugs and vaccine by accelerating the operationalization of African Medicine Agency, because it will really help us to harmonize a little bit the regulation for the registration of key drugs. It will improve our regulatory system from maturity 2 to maturity 3 levels, which is a very technical word, but it just means that it will give you possibility to produce drug and sell it, to produce vaccine and sell it out of your own country. So for me, because you will comply with international practices and best standards. So for me, that is key. We cannot today, like I said, only 1.6% of all vaccine which has been distributed have been received by Africa. 1.6% of the total vaccine, COVID vaccine, who have been made available for the world, we receive only 1.6% of those vaccines. So we have something to do. We cannot sit and wait for the next pandemic to say, oh, we don't have vaccine again, we don't have the drugs, we don't know how to. So for me, that is a key, honestly.
Great. I think we'll take one more question before we open up for the audience to ask us. I see Yannick is already back on the camera, probably is what you want to say.
Time is flat.
It's a flag, yeah. I was reflecting on this pandemic. I'm sure it's not the last. And are we, as a continent, prepared for future pandemics? Are we prepared?
I think we need to. I think it's very important questions as leaders and people who are involved in this pandemic control. I think we need to understand that we will have more and more new type of pandemics, because if you look at even since 1918, you know, the first pandemic with Spanish, the first virus we had, the time between pandemics are becoming shorter. So we will have more and more pandemics. So what I personally feel, which is critical, is that a capacity to monitor emerging infectious disease need to be well established, and we need to have a strategic national stockpiling of resources and support the states, I think, in their preparedness and response. But also, it will not happen without the data. We need to have an effective, approach in terms of data and consistent voice, which will be helping to make sure that anything we will be doing will be based on sound science. So build those capacity in the countries will be very critical. More training of communities involvement, reinforcing the interface between certainly the last provider and communities. I personally feel also we need to learn lessons about infrastructure and supply chains, coordination. I can go, those are the areas which we all are struggling with, and we need to work more on it.
Great. This was a very fantastic conversation. Thank you so much, Michel. It's a pleasure. And I'm sure we could have more time and have more conversation questions, but let's just take maybe a next step to take a few questions. I don't know, Yannick, you already have questions in the chat box, or do we have some?
We have, so the problem is we have around 98 questions. We cannot take all of them, we only have 2 minutes. So I'm just gonna say the 2 first questions, and I apologize, Your Excellencies and everybody, don't get offended. The first question comes from Dr. Murekezi. Can the African medicine agents mobilize quickly enough to respond to growing healthcare issues?
Yes, I think it's very important, because healthcare issues will send us to what I personally feel first is we need today to have, I will say, key elements which are critical, and African Medicine Agency can certainly contribute in some way on that one, is how to really make sure that we have sustainable and predictable financing. It's critical for whatever you can do for your health outcomes in the future. I think how we will be, and again, Kigali is working on that, Rwanda is working on that, scaling innovation, not just taken on stage by a feel-good projects, which are very nice in, but scaling innovation. I think that is very important, and African medicine can really look on all innovative approach, which are in different places in terms of regulation, in terms of standard setting, in terms of reinforcing health capacity, but also I think using data for decision making. I think that is critical, and work more systematically and strategically with change agents to support the development, I think, honestly, the development of context-specific evidence-based solution. Because the difficulties we have today, if you look at, one day they told us AstraZeneca is good, second day is not good, so we have to go to African European Medicine Agency, wait for their decision coming back. So I think it's important that our decisions are context-specific and evidence-based solution. And for me, that's also will be part of what I personally feel AMA can bring.
Excellent. So we're going to take the last question. The last question comes from Ambassador Rod Adam. Where is the institute is going to be based? Rwanda deserves it after witnessing a such efficient way of distributing vaccines.
I think that is it will be a decision of the assembly. I think criteria will be defined, and Rwanda will certainly be part of countries who will apply for hosting and a visa agency. But to be honest, I want to also say that the leadership of Rwanda, if I have to take some few things from my personal, is engaging only me. I think it is a leadership with forward-looking and with a clear vision built on accountability and citizen-centered development. And for me, that is critical. It is today, from my last visit, I realized that they are building knowledge economy. They are not just going for infrastructure, but they want the human capacity. And now establishing some kind of a smart partnership. I saw what they are doing on bioequivalence, what they are doing on pharmacovigilance and others, and regulatory system. So it's based on a contract approach, is based on accountability for results. And for me, those are certainly criteria which will certainly be part of the package for decision. But it will be the assembly which will decide which country will be hosting this African Medicine Agency.
Absolutely. Thank you, Doctor. I mean, what Dr. Sabin's team is doing is amazing. Dr. Sabin, I hope you write a book after this pandemic and COVID, because what you guys have been doing, it's remarkable and amazing. But anyway, Honorable Michel, thank you very much for your time. It's good to have you. Merci beaucoup pour votre temps, toujours.
Merci.
And,
merci beaucoup, j'ai beaucoup apprécié.
Merci beaucoup, c'est gentil de votre part et votre temps. And
yes, I didn't see the time flying like that. I just said, my gosh.
No, after COVID, when you're back in Rwanda, we'll sit for 2 hours conversation. I mean, there's a lot of...
Exactly.
This is just the beginning of a conversation, but thank you very much.
No, I think I am very impressed. Let us continue like that. That's what I'm calling building knowledge economy, is transferring competencies, making sure that our continent can really learn from the best experience and share it and make it different for generation to come. Thank you very much.
Thank you.
Thank you. I think for me, there are two things taking home is leaving no one behind in this process. And AMA is not a dream. It's actually happening now. And Honorable Michel, you're going to take this to help us make it. So thank you so much. Thank you, Yannick, for having us.
Thank you.
Thank you very much.
Thanks. Thank you. Bye.